judges, and investors. My name is Makafui, and I am a health entrepreneur. As a certified preventive health nurse, I've seen firsthand the healthcare challenges in rural communities in Ghana. According to the Ministry of Health in 2021, a doctor-to-patient ratio is at 1:6,000 and above. Thus, the private and the public hospitals were available to 34% of the urban localities, whilst only 2% of the rural communities had access to such hospitals. Many were left without access to healthcare due to geographical locations, financial constraints, mode of transportation, and poor road network as identified by the Ministry of Health. This crisis affecting thousands of people, including my family. This is where Makafui's mobile nursing comes in. Makafui's mobile nursing is a mobile healthcare clinic aimed to provide essential healthcare to underserved and remote communities in the Volta region of Ghana. Communities like Bamima, Blemazado, Laoshima, and many others. Our mobile van shall be equipped with basic medical equipment, staffed with healthcare professionals, and supported with digital health technology. Our services will include regular health checkups, maternal health care, management of chronic diseases, and telecommunications. This unique model brings healthcare to the doorsteps of the patients without having to travel. Our focus is not only going to be on the rural communities. Our secondary targets are those in the urban centers. We will have the Makafui's mobile nursing app, a technology that facilitates home care nursing, where we manage patients with underlying health conditions. Is this not an avenue for jobs to my fellow nurses? Yes. Now, every qualified Ghanaian nurse can just do pak on the app by subscribing for free, whilst we train them on our company policies and equip them for a period of 3 months before employing. The interesting thing here will be we're leveraging our telemedicine technology to provide top-notch care to our clients. The market size for healthcare in rural communities is vast, with over 60% of rural communities lacking access to basic health care. Lacking access to basic health care. Initially, our focus was on the Volta region, but due to its potentials, expanding across Ghana is significant. And also, considering the health issues across West Africa. Our go-to-market strategy will include combination of community engagement and strategic partnerships with hospitals. We focus on building relationships with local leaders and organizations to introduce our services into the rural communities. We leverage on our telemedicine technology to reach out to patients who need home care nursing by using digital marketing, community workshops, and free healthcare days to create awareness and to drive adoption of our services. Our business model shall be built on sustainability and scalability. Using flexible revenue model by combining pay-per-patient fees and subscription plans for families and communities who requesting regular medical attention. We shall have partnerships with organizations like the Tanko Foundation, the Livingstone Foundation, the Ghana Health Service, and the National Health Insurance Authorities to help subsidize costs and expand our services. We shall make significant strides using our mobile unit to serve hard-to-reach communities in the Volta region. Our telemedicine technology will enable us to manage complex cases and improve health outcomes. We estimate serving over 600 patients a month per mobile unit, with each patient generating an amount of 50 Ghana cedis. Our monthly income will be 30,000 Ghana cedis. After accounting for operational costs, we expect to make a profit within the first 18 months with an initial investment of 1.8 million Ghana cedis to expand our fleet and technology capabilities. Our team shall comprise highly skilled professionals with deep expertise in healthcare, technology, and community engagement. Our vision is bold but clear: to revolutionize healthcare delivery in Ghana, bridging the gaps in rural communities and empowering the urban centers with quality home care nursing. Through the Makafui's mobile nursing app, we aim to improve on health outcomes, reduce mortality rates, and create sustainable jobs for healthcare professionals. Dear judges and Ms. Makafui, for subscribing to our premium services, here is your package. Join us on this transformative journey to create a healthier, stronger, and better Ghana. Makafui's mobile nursing, bringing healthcare to your doorsteps, a community at a time. Thank you.
Makafui from the Volta region presenting to us Makafui's mobile nursing. And guess what? Not only our judges got some goodie bags, I actually also got one here hanging right here on my arm, and I'm definitely going to explore everything in it. But let me move over to our judges and find out what they think. I can see they are still trying to find out what's in those goodie bags. But let me come to you, Comfort. What are your thoughts on Makafui's mobile nursing?
Makafui, mobile nursing, well done. I think so far you've been the one person who's been able to articulate most of the things we are looking out for. So I would like to say well done to doing that. I like so is this what every person who subscribes to your healthcare package will get?
Yes, please. They'll get a first aid kit.
So this is a first aid kit for everyone who subscribes to this.
Yes,
and you're asking us that we should pay 50 cedis per subscription or per each time that we use your app, which is which?
Okay, the 50 cedis is for the local communities, the rural communities, because they don't have that much money, financial assistance. So we go to the communities with our mobile van and making it affordable for them to purchase.
Yeah. So are they also going to get, with their 50 Cs, are they getting this as well?
Those with enough money that can access, and they want the subscription plan, we have partnerships with organizations that will cover for them if they don't have the money. So the organization will cover for their services.
Fantastic. Okay, then. One thing that you should do then is to, I mean, you've differentiated your markets all right, but I think you further need to prune it down because every new business like yours first has to pilot. So where will you choose to pilot? About how many people will you use in that space? Having piloted, then you'll be able to say, okay, this thing works for X number of people. The pricing was good, the pricing was not good, so on and so forth. The van, because going around with the van, you must think of consumables like petrol, you know, all that kind of stuff. So that's, if you are building a business, all this must be in your business plan. And then you see the fact that, will this business thrive or not? I want to say, though, that because you are looking at engaging nurses, who are professional nurses, that's a good way that your program could be a possible way of employing young nurses who may not have jobs. So yes, indeed, you are solving a very crucial healthcare problem here in our society. let's tweak it a little bit more. Let's see how we can make it work. And who knows, maybe in 2 years' time, it will be rolled out. Congratulations.
Thank you.
All right, Dr. Ellen Hagan, is this an idea you're going to invest in?
Yeah, I'm tempted strongly. First of all, I think your dress is fantastic. It suits you. You look great. I wish I could look as good in it. You're more beggar. But I also realized that your business proposition makes sense. It's solving several problems. Healthcare availability for the urban, and as well as for the what do you call it?
The rural community.
The rural communities, yes. So it's good getting home care, bringing the service to the doorstep, which means the old people who can't go to the hospital. Yes, fantastic. I love your strategy as well, because I was wondering, your team of people, how are you going to pay them with this, your measly 50 cedis per patient and targeting 600 people? How will you pay your very, efficient and qualified healthcare providers? So I love the partnerships. I know that 100% of zero is zero. So I love the idea that you're going to involve partners in this to help you pay for some of your overheads. Yes. I'm not too sure about the financials, the way you've presented them, but I think it's a start, and you need to look at the figures properly, because they don't look as realistic as we expect. I don't know whether I heard right, but you talked about mobile, a van of some sort.
Yes, please.
Yes, so there's nothing in your overheads. So you see, we have to be realistic. We are doing this to encourage people to go into entrepreneurship, but you need to be practical. Where are you going to get your vans? How many are you going to do? You said you are going to start with
It's an initial investment of 1.8 million.
exactly. Where is that coming from? From us.
From the investors.
And when will we get our money back? So that bit, I think, needs a little work, but I'm tempted to look at that. But you see, when you are successful entrepreneurs, we just don't solve problems. When you solve the problems, you also have to look at the future so that we see whether it will be sustainable or not. So yeah, you're on the right track, but you have to put some work on it.
Thank you.
Thank you so much.